It's taken several stuttering weeks to develop and validate an accurate antibody test for COVID-19, but the government now has 10 million available. Health and care staff, patients and residents will be front of the queue.
It's not just about the clinical advances that these tests can bring, although obviously that's important. It's that knowing that you have these antibodies will help us to understand more in the future if you are at lower risk of catching coronavirus, of dying from coronavirus, and of transmitting coronavirus.
At the moment, swab tests are used to check whether people currently have the coronavirus. The new blood test for antibodies will tell scientists how many people have had the infection since the start of the outbreak.
It came in a box with the instructions. The first thing you see is the warning to say that you have to follow the instructions very carefully before you do anything. And then the instructions are very comprehensive, telling you how to wash your hands first, make sure you have plenty to drink. And then the next step is to swab your finger with the alcohol swab to make sure it's clean. And then the dreaded task of removing the safety cap from the lancet and pressing it down into your finger to get the blood out.
Private testing is also about to take off. Martin Bamford bought a kit from a high street pharmacy. He'll post a blood sample to a lab. He had a severe sore throat and fatigue in early February, but dismissed it as just a winter bug. Now he's not so sure.
I think I might be slightly less cautious, slightly less anxious if I found out I have had it and I possibly have immunity to it. But I'm generally quite a cautious person anyway. I don't really leave the house. I follow the government's advice, so I suspect it won't. If I find out I haven't had it, I'll probably become even more cautious and probably slightly more anxious.
The World Health Organization has warned that antibody tests, whether through the NHS or private kits, give no guarantee on immunity, and health and care workers would still need PPE.
I think there's a really strong curiosity and compulsion that's driving us to want, on a personal level, these tests. But what we need to realise is that at the moment, it doesn't offer any individual benefit to know whether your antibody test is positive, because we don't have enough certainty that a positive antibody test will definitely protect you from infection.
As more people take the test, the better the data. Small studies suggest 17% of people in London and a little over 5% in the rest of the country have had the virus. More wide-scale testing will tell scientists how it's spreading. Thomas Moore, Sky News.